Good evening. I'm Dr. Amy Eggleston, and today is the first in a two-part series speaking about PPID, or what you may know as Cushing's disease. Today we'll discuss 1. In brief, what is Cushing's disease, or PPID? 2. The clinical signs that are seen in early and advanced stages of PPID. And 3. Important updates regarding the testing to detect PPID. Horses are living longer and healthier lives. This is a result of improved preventative health standards, improved detection of, and better management of various disease processes. The average age at which horses are considered geriatric has moved from 16 to 20 years of age. The average lifespan of a horse is now 25 to 30 years of age. This is the equivalent of a 75 to 85-year-old person. Horse owners and horse health care advocates are more interested than ever in how best to preserve the health, athletic function, and quality of life of horses well into their 20s. This includes education and recognition of certain health concerns that horses are more prone to developing as they age. One such health concern is pituitary pars intermedia dysfunction, PPID, commonly known as Cushing's disease. PPID is an endocrine or metabolic disorder, meaning that there is an abnormal process of chemical reactions in the body that alters the body's metabolic processes. In PPID, there is an abnormal production of hormones that alters the horse's metabolism process and affects the horse in many ways. Dogs and humans may also be diagnosed with PPID. However, it's not the same as we see in horses. In dogs and humans, PPID is typically caused by a hormone-secreting tumor of the anterior or front aspect of the pituitary gland, which is located at the base of the brain. PPID in horses, by contrast, involves dysfunction at the intermediate lobe of the pituitary gland. In most horses, there is not a tumor or neoplasia, as much as there is an enlargement of the intermediate lobe due to a lack of regulation by neurons from the hypothalamus. The result is therefore an overproduction of a different profile of hormones than in dogs and humans. In more advanced cases of PPID, a tumor known as a functional pituitary adenoma may develop. PPID is a disease process we used to associate with and diagnosed more commonly in older, geriatric-aged horses. However, in the last 5 to 7 years, horses are regularly diagnosed with PPID during middle age, 13 to 15 years of age. It isn't that horses are becoming afflicted with PPID earlier and earlier. It is that our testing is more specific in its detection. PPID is a disease process that slowly evolves over time. Horses develop enlarged pituitary intermediate lobes in their preteen to early teenage years, and now we are more accurately able to detect this process as opposed to when the PPID became more severe with horses well into their 20s. With earlier PPID detection, we now recognize more subtle but significant clinical signs of early onset PPID. These may include a change in attitude or lethargy, decreased athletic performance, regional increased hair growth, regional delayed hair shedding, loss of or decreased top-line musculature, abnormal sweating, increased or decreased, regional fat deposits, desmitis or skin problems, tendinitis, laminitis, which might also be associated with repeat foot abscesses, high fecal egg count results, especially in the face of otherwise good management or previously normal fecal egg counts. Clinical signs associated with advanced progression of PPID may include dull or altered mentation, exercise intolerance, generalized increased hair growth, loss of proper seasonal hair coat and shedding, muscle atrophy, especially along the top line, neck, and hindquarters, a hay belly, abnormal sweating, increased drinking and or increased urination, fat deposits. In mares, you might see false lactation, onset of blindness, parasitism, tendon and suspensory ligament laxity, and laminitis or founder. It's important to note with all these clinical signs, early or advanced stages of PPID, not all of the clinical signs listed will be seen. Sometimes just one or two will be noted by an astute veterinarian on an annual physical examination. As mentioned, there are important updates on testing for diagnosis of PPID. There are two blood tests for the diagnosis of PPID. One, a resting, not exercised, ACTH level, and two, the thyrotropin releasing hormone, TRH, stimulation test. This is a particularly useful test when horses with early PPID have normal resting ACTH concentrations. TRH causes the pituitary gland to release more hormones, and ACTH concentrations increase to a higher level in the horses with PPID. This test is easily performed on the farm by taking a baseline blood sample, injecting TRH intravenously, and collecting a second blood sample 10 minutes later. When presented with a horse with clinical history and signs consistent with PPID, if those signs are equivocal or early in nature, it is necessary to utilize a TRH stimulation test for blood work diagnosis. If the blood work result is high, the horse is considered positive for PPID and pergolide treatment is recommended. If the blood result is normal or equivocal, then it is recommended to retest the horse in 3 to 6 months using the TRH stimulation test. Now, when presented with a horse with moderate or advanced signs consistent with PPID, a resting ACTH blood test may be performed. If the result is high, the horse is considered positive for PPID and pergolide treatment is recommended. However, if the result is normal or equivocal, then a TRH stimulation test is recommended. If that result is high, the horse is considered positive for PPID and pergolide treatment is recommended. If that result continues to be normal or equivocal, then it's recommended to retest the horse in 3 to 6 months. In all stages of PPID, it's also recommended to perform blood work to determine whether insulin function is also affected. Horses with PPID that are also determined to have altered insulin function typically require more strict dietary parameters. A few additional points about PPID blood testing of importance. 1. The TRH stimulation test has established diagnostic value that is more sensitive than a resting ACTH. This minimizes the frustration of false positives and false negatives with the ACTH test, especially with regards to early onset cases. 2. The TRH stimulation test does not have established diagnostic value between mid-July to mid-November. This is an active area of research, but due to seasonal effects of the pituitary and hypothalamus on ACTH levels, there are not established parameters for these months as ACTH are increased even in normal horses. Results during this time should be interpreted with caution. 3. These are the only 2 blood tests that are recommended for PPID diagnosis. This concludes part 1 of our 2-part series on equine PPID. Please watch for release of the second part that will discuss updated recommendations regarding treatment and management of PPID in a horse. If you suspect your horse may have PPID, please call us at 860-942-3365 for a consult, exam, and/or testing. Thank you.